Oh, hi. My name is Dr. Todd and I'm the CMO of a software company that is dedicated to getting evidence to the people. So you must be wondering, why is a doctor sitting in an office instead of working in a hospital or a clinic? I was once a hospitalist and a medical director of a large physician group. I saw thousands of patients get the right treatment, get cured, get better. But I also saw way too many patients get the wrong diagnosis or the wrong treatment. And I came to the conclusion that that wouldn't have happened if those patients and their doctors had used evidence. This is one of a few companies dedicated to getting consumers to use evidence whenever they hear a claim from an expert or get a recommendation from a doctor. The other companies are called Sense About Science and Patients Like Me. This is Doctor Evidence, and all of these people and all of these computers are 24/7 looking for and delivering the data, the evidence that can answer any medical question. So all of you out there in video land, have you ever asked your doctor for evidence after they've given you a prescription for a medication or recommended a surgery? I'm guessing most of you are not raising your hand right now. Now, raise your hand if you've ever used evidence when you bought a car and went to Carfax, or bought a mutual fund and went to E-Trade, or bought an appliance and went to Consumer Reports, or bought a book and went to Amazon.com. I'm betting most of you are raising your hand right now. The data and evidence that you would find on these consumer sites is very similar to the evidence you would find in a clinical trial. So why is it that you all want to use evidence when you buy a car or a house or a boat or an appliance or a mutual fund, but you never think to ask your doctor for evidence when they tell you to undergo a surgery or have a scope put up your bum or go on a medication for the rest of your life? I've interviewed thousands of patients over the years, and I know the answers to these questions. Patients aren't demanding evidence from their doctors because they trust their doctors. My doctor's the best. He uses evidence, I'm sure. Or they're just too afraid to confront their doctor and demand evidence. Or they think they don't understand evidence. Or they're too busy to use evidence. Fear, trust, laziness increases the probability you will make an uninformed decision and possibly get the wrong treatment. At this point, all of you should be asking the following questions. Does my doctor order the best therapy based on a complete review of all the relevant outcome data that is available? Is my doctor ordering a therapy that the insurance companies force him or her to order? Or ordering a therapy that is just considered standard of care? Or is my doctor recommending a surgery because they are a surgeon? Or radiation because they are a radiologist? Do you end up getting a treatment that depends more on your insurance status, where you live, or the time of day you were seen in an emergency room? These are critical questions to answer. Why? You know why, because thousands of patients have been proven to get the wrong treatment, unnecessary treatments, the wrong diagnosis. Why would anyone not want to use evidence to make sure they're getting the right treatment? Why would anyone just rely on opinions from experts or doctors who may have not read all the evidence? Why would you take a chance that you're not getting the best treatment for your unique medical condition? Every one of you should be saying, show me the evidence.